Okay, I think we will get started right on time and let people join in the next few minutes. So thank you everyone for joining us today. My name's Bethan. I am a local development advisor at the Early Intervention Foundation, and I'm here with Virginia and Miriam and Di today, and we will be leading this webinar on supporting healthy relationships among minority ethnic parents. So just to start with a little bit of housekeeping, and I think I've seen in the chat as well, that the webinar is going to be recorded, but it will only be the presenters and the slides that are visible in that recording. So your cameras and your sound is automatically switched off, so not to worry about that. We will share that recording after the session. So that will be a recording of the webinar with the slides and the links to any of the resources that we discussed today as well. So before we get started fully, I just wanted to take a couple of minutes to set the context for the webinar. And our vision at EIF is that all children are able to achieve their full potential. And to make this a reality, our work must reflect the realities of the society that we live in. And recognising and understanding inequality in our society and championing equality in its place is therefore integral to our mission as an organisation. And we recognise that both as an employer, but also as a research organisation, that we have much more to do to ensure that the values of equality, diversity and inclusion are reflected and reinforced in everything that we do. So one of the actions that we've set ourselves as an organisation is to plan our research to address inequalities in society and to recognise that through our research and our work to inform policy and practice, that we have a real opportunity to improve understanding of the inequalities that exist in society in terms of the experiences and the outcomes, and to identify ways to help address those inequalities. So we've also set ourselves the aim of developing a work programme that meets the needs of a diverse society so that all children that are at risk of poor outcomes can benefit from early intervention. And as part of this work, we recognise that we need to be assertive about the needs of minority ethnic families and to support others to do the same. So hopefully that sets a little bit of the context for today, but just as a short introduction to EIF, for those that don't know, the Early Intervention Foundation has for almost 10 years now championed and supported the use of effective early intervention to improve the lives of children and young people who are at risk of experiencing poor outcomes. And as a member of the government's What Works network, we have a pivotal role as the go-to source for evidence and advice on effective early intervention for children and young people. And our work focuses on a three-part model, so making the case for early intervention, generating evidence, and using that evidence to change policy and practice. And as you hopefully know, we cover a wide range of areas, one of which is reducing parental conflict. And that work, which is funded by the DWP, we also have developed a number of resources in this area, which hopefully you're familiar with, and one of which we will discuss in a little bit more detail today, which is one of our evidence guides. And so just finally, before I hand over to Miriam, having sort of introduced the context for the webinar, I wanted to set out sort of what we're hoping to cover over the next hour. So as part of our work to understand how race and ethnicity influence children's outcomes, we carried out some research alongside the Race Equality Foundation and Action for Children to understand the experiences of minority ethnic families in accessing and receiving family support, and to better understand the challenges and opportunities in how family support services work for minority ethnic families and young people. And Miriam is going to take us through the key findings of that work very shortly. And we hope that that's helpful in considering how you might develop similar work to understand the needs of minority ethnic families and how their needs can be met locally. And will also then lead us into a more specific discussion about supporting healthy relationships among minority ethnic families and what that might mean for you in your roles. So thinking about how we can take an understanding of the inequality that exists and consider this more specifically in the context of parental conflict. So as hopefully you've already seen, the chat is open and we'll encourage you to share your reflections and your questions. And we will pause after the first section and then again at the end of the webinar for any questions. So if we don't get to all of those questions today, or there are any that we don't feel we can answer today, we will share a Q&A after the webinar. So if there's something that you think is important and you're able to like it, then please do so, and then we can prioritise those in the two sections where we can take questions. So Miriam, I'm going to hand over to you now, and I shall move us on to your slides. Thank you.
Thank you. So my name is Miriam. I'm a Senior Research Officer at the Early Intervention Foundation. And as Bethan said, I'm going to talk to you about a large-scale piece of qualitative research that we conducted last year with a focus on improving the way family support services work for minority ethnic families. And if I have the next slide, I can talk to you about the background and the rationale for this work. So I'm sure you'll all be aware that there are stark and persistent inequalities in outcomes for children from minority ethnic groups, for example, in relation to child development, but also academic achievement, health, and school exclusions, for example. There are also some risk factors that disproportionately affect certain ethnic groups, for example, neighborhood deprivation or perinatal mental health, to name just a few. But we also know that high quality family support, when delivered in the right way and at the right time, can really make a difference for children and their families. However, statistics show that the rate of children looked after on protection plans varies by ethnic group, and that suggests that early help may either not reach all families or it may not have the same impact on all families. And unfortunately, there's a lack of a consistent national data set, and that obscures our understanding of families' journeys through universal services and early help. So we wanted to conduct some research to better understand what is happening, whether families are, for example, reluctant to engage with services, or whether the way services are designed is perhaps not right for families from all ethnic backgrounds. And then next slide, please. To do this work, as Beth mentioned earlier, we partnered with the Race Equality Foundation as well as with Action for Children. And our aims were to understand the priorities and experiences of minority ethnic children and families in relation to family support, and then importantly, to provide a platform for the voices of the research participants in policy making, and also make recommendations on how services could better meet the needs of minority ethnic populations. For the purposes of our research, we have defined family support as any service designed to help children and families deal with challenges, including but not limited to universal services such as GPs, health visitors in schools, and targeted services such as CAMS, children's social services, and early help services. Our research consisted of a qualitative survey for which we used a survey platform where participants could share voice notes to discuss their experiences. This was followed by focus group discussions, and through this way, we really gathered an incredibly rich data set, as a lot of people chose to submit voice notes through the survey. And throughout this project, we worked with an advisory group as well as with a co-creation group of parents and a group of young people to make sure that we are hearing things right and we're drawing the right conclusions based on what people are telling us. We could go to the next slide, please. Yeah, here's an overview of participant demographics based on the survey data. We haven't collected the same information for the focus groups. So as you can see, we had 101 parents as well as 59 young people completing the survey, coming from a range of ethnic backgrounds and living in various regions across England. So even though the sample overall is quite large for a piece of qualitative research, for each of the subgroups, the sample size is quite small so that we weren't able to make comparisons across the different groups or across the different regions. And I'm sure everyone here will agree that a lot of that understanding needs to happen at the local level. So even though a lot of these insights are definitely reflected in a variety of contexts, of course, there's going to be a lot of variety and heterogeneity across these experiences, across different localities, as well as across different ethnic groups and across different services, as well as across different support needs. Can we go to the next slide, please? So these are the three key themes that came out of what we heard from the families and young people who participated in the research. Firstly, racism and discrimination came out as a cross-cutting theme, both in relation to trying to access services, but also in relation to interactions with services. Secondly, accessibility was a key issue. A few people mentioned well-known barriers in relation to, for example, time and cost and childcare needs. However, the barrier that was most commonly discussed was actually not being listened to or not being taken seriously when trying to get support in the first instance. Participants mentioned, for example, having to constantly beg for support, or not being taken seriously, or never hearing back to emails sent. A few people also mentioned that they called up a number of telephone numbers that they found on the council website that were simply outdated, and the services didn't exist anymore, which made it very difficult for people to find the right service. A few people also mentioned that they were successfully referred, which was quite positive, but the number of comments around accessibility challenges really was overwhelming. Thirdly, parents and young people discussed challenging experiences within services. So that sometimes related to the intervention they received specifically. For example, interventions came too late, or were too short, or felt too generic. But a lot of the comments also focused on practitioner characteristics and skills, for example, cultural sensitivity, but also basic relationship skills such as active listening. Participants sometimes felt judged, and we had one closed question where 40% of participants actually said that they felt the support either made no difference or made things worse, which is quite a concern. Of course, other participants also highlighted that they felt better after receiving the service. That's what the services are for, after all. Interestingly, participants noted that there was a lot of difference in the experiences that they have had with different practitioners as well as with different services. For example, a few participants highlighted that charities in particular were very supportive, as well as a few people who highlighted that they had more positive experiences when they interacted with a practitioner with a similar religious or ethnic background as themselves. Now, if we can go to the next slide, we can have a quick look at some of the ways to improve families' experience. So, for example, consultation with local families to understand their experiences is important to really acknowledge what is happening and then seek ways to address them. And perhaps also go beyond a strategy and beyond a statement of intention, but really thinking about ways to be accountable to those strategies and make sure that what has been agreed with families is actually what is reflected in practice. Of course, services should also be designed based on an understanding of the needs of minority ethnic families and respond to those needs. Again, working closely with local families is a key point here, and really understanding that perspective and prioritizing those needs. Importantly, also initial interactions. Of course, the way people first encounter services can set the scene for an overall positive experience, or it can overshadow that experience throughout. So that's also something to consider. And then fourthly, having a judgment-free space, having a practitioner who listens attentively to families' needs, validates their feelings and respects and empowers families' autonomy is also crucial. We could go to the next slide. There are some things that you might want to consider if you're working on your local strategy. For example, a question you might want to ask is, how can services working with children and families ensure support is inclusive for minority ethnic families? Or another question would be, how can practitioners be supported to build trusting relationships with minority ethnic families? Or how can we ensure all minority ethnic families are able to access support when and where it is needed? And how can early help and wider family support services better respond to the needs of minority ethnic families in your local area? These clearly are important questions to consider, and there aren't any easy answers for those, but I think it's important that we acknowledge that there is a need to ask these questions and a need to consider ways to answer them. And to be honest, when we analyzed the findings from the qualitative research, we were quite shocked by, to see these findings in this shape, and also to see that we don't have detailed and specific answers to these questions that are posted on this slide here. We're currently conducting further research with local areas to explore these questions further. And we're hoping to hear from local areas about various approaches. And if you'd like to get involved in this work, please get in touch after the session. We're really keen to hear about your local area's experience in tackling some of these really critical and difficult questions. And I'll just stop here to see if you had any reflections or questions on this research. And I'd be really interested in hearing whether you feel these findings are reflective of your context. Have you observed other challenges, or have you perhaps developed any ways to respond to these challenges? Thank you.
So we haven't had any questions in the chat as yet, Miriam, but I'm just wondering whether you could say something about the opportunity that the development of family hubs gives us in the context of working with minority ethnic parents, children, young people and families.
Yes, thank you very much, Di. That's a very interesting question. And I think we heard a lot from families around difficulties with accessing the right service and trying various places, but not finding the right place. And of course, the idea of family hubs is a very obvious answer to that question, really, as a place where families can go and be directed to the right type of service. So I think it's important that when thinking about the development of family hubs, those experiences of minority ethnic families that we know about are kept in mind, and that they feed into those planning decisions to make sure that relevant services, including third sector organizations, are really linked up with family hubs, to make sure that that is really that comprehensive support system that it's envisioned to be.
Okay, thank you, Miriam. We've got a couple of questions coming in now. We've got a question from Fran. Fran's asking, were these families that were part of the survey, were they from minority groups but British born, or were they born elsewhere and now in the UK? So were they English speakers?
It's a mix of both. So yes, but both groups were included.
Okay.
Yep. Not sure. Don't exactly the proportion of people who are foreign born versus who weren't. We did have a couple of comments from people talking specifically about services not understanding the migrant experience sufficiently well, so that definitely was an issue. But a lot of comments also was from British-born native speakers. Interestingly, we didn't have a lot of comments around language needs. And when we were setting up this survey, we were thinking a lot about whether we should translate the entire survey. And we ended up providing the questions in English, but allowing people to answer the questionnaire in any language of their choosing. I'm not sure whether that's a reason why we didn't have so many answers from people who weren't fluent in English, because perhaps having the questionnaire in English only was a reason why people couldn't actually engage with the research sufficiently well.
There's another question here, which I don't know whether you'll be able to answer, but around the language that we're using of minority ethnic families, and a query about whether the phrase global majority is more empowering for people. So this is Rachel. And she says, our agency and Hackney are clear strategically on this important use of language. So very interesting. I don't know whether you want to comment about that, Miriam.
Yeah, happy to do so. It's a brilliant question. Thank you for that. So we actually have developed our language principles in collaboration with the Race Equality Foundation through a number of action learning sets. And the reason we've settled on this phrase minority ethnic families is because we are very much focused on England, on the UK. And even though people are perhaps belong to a global majority, people are living the reality as a minority ethnic group. But also within this term minority ethnic groups, we are talking about a lot of different ethnic groups. It's not one global majority, but there's a lot of heterogeneity across the groups, and I think that's really where we've landed on this term of using minority ethnic as a descriptor. And it's perhaps also worth noting that we consciously choose to say minority ethnic rather than ethnic minority, as it's often done, because it's very important to recognize that everyone has an ethnicity, and it's not that there is a subgroup of people who are ethnic, but everyone has an ethnicity. And whether that's a minority ethnic background where someone comes from, or whether that's the majority ethnic background, it's important, I think, to understand that everyone has an ethnicity really that shapes their worldview and their perspective.
Okay, thanks, Miriam. We've got a couple of other comments and questions if we've got a little bit more time. So I'll just continue with the next one. This is a comment from Fataha, and she's saying, I'm not surprised with the findings. I work with families who've migrated to the UK, and accessing services continues to be a challenge. The lack of appropriate interpreters in school and healthcare is a huge challenge for families. So really, really important comment there about the need for additional resources around interpretation and translation. And then there's a comment from Eric. The research seems to have confirmed what has always been known and experienced by minority ethnic families. Has the research explored any progress, and what contributed to any progress? So again, really interesting question there, Miriam.
Yeah, that's a great question. And in terms of progress, I mean, it was a piece of qualitative research at one point in time, so we haven't tracked progress. It would be interesting, I suppose, to do a similar piece of work in the future, for example, after family hubs have been created, and see to what extent that has addressed these needs. But I think the important piece of work that really needs to be done now in terms of research is really to understand how these challenges can be addressed. Because like the commenter said, these are things that perhaps aren't new. The research has more confirmed some of these experiences that have been around for a long time. And I think what we would really hope that is, if we would repeat this research in the future, that we would have different findings. And I think the critical question now is what needs to happen to change those experiences and to really improve them. And I think working with local areas as well as with families in developing a support system that's really more responsive to all families' needs is crucial at this point in time.
Okay, thanks, Miriam. I think that's all the questions that we have for the time being. Just to mention that Virginia has put a link up to the EIF language principles on the chat, so people can have a look at that. And I think we'll just perhaps move on now with the presentation.
Thank you.
Thank you very much. So in the first part of the webinar, we discussed experiences of families. And in this part of the webinar, in the second part, we're just exploring how supporting healthy relationships among minority ethnic parents can happen at the local level, and how research evidence can inform our strategy. Just before starting, my name is Virginia Chiara. I'm the head of What Works for Parental Relationships at EIF, and I've been working on reducing parental conflict and how to support healthy relationships for the last few years. Recently, we have produced a new guide on supporting healthy relationships among minority ethnic parents, and I'm going at the moment just to send the link to the chat so you can also take a look. Today in the presentation, we are just going through some of the key messages from the guide. But actually, if you have any questions, you might want to consult the full guide to find more information about how to support minority ethnic parents. So if you can move to the next slide, please. The first consideration we have to make when thinking about how to support parental relationships among minority ethnic families is that at the moment there is very limited evidence from the UK on the impact of parental conflict on children from minority ethnic groups. And a second very important consideration is also that there is limited evidence on the prevalence of parental conflict among minority ethnic families. However, if we look at the research evidence available, and if we look at international studies, we can see that there are more similarities than differences across cultures in the way in which parental conflict can impact children. There are a few caveats that we should consider when thinking about the evidence in relation to minority ethnic families. The first caveat is that when you think about parental conflict and how parental conflict can impact children, sometimes there is a relationship between experiencing parental conflict and parenting practices. If you think at minority ethnic parents, we don't have enough evidence to understand that relationship. And we also know that parenting practices can change across different minority ethnic groups. So this is something that we should consider when thinking about supporting relationships with minority ethnic families. A second very important caveat is very linked to what Miriam was discussing in the first part of the webinar. We know that experiences of racism and discrimination can impact parenting practices. Therefore, this is also something that should be taken into account when we think about the support we provide to family and when we think about questions regarding parenting practices and parental conflict. If we can move to the next slide, please. As I mentioned, we have limited evidence about the impact of parental conflict on minority ethnic children. However, we know that there are a lot of similarities if you consider white British children and minority ethnic children. In general, when we think about parental conflict, the first child outcome that we consider is poor mental health and psychological well-being and how this can be negatively impacted by parental conflict. But actually, there are different outcomes that can be impacted. And this is just a visualization of the most important. If we are starting from the top, we can see physical health problems. We know that sometimes physical health can be impacted negatively by parental conflict. For instance, during childhood, it could happen through a higher level of fatigue or headaches. Poor academic performance can also be impacted by parental conflict, as well as low employability and poor economic outcomes later in life, especially in adulthood, of course. Social and interpersonal relationships can also be negatively impacted during childhood, adolescence, and then in adulthood for children exposed to parental conflict, as well as sleep problems, behavioral problems, risky health behaviors, of course, more disease, more prevalent during adolescence. And then again, mental health and well-being. And these can happen in different ways, depending on the child. So we saw that there are some differences sometimes between boys and girls, but actually it might really depend on the age and how parental conflict is experienced in the particular home where the child lives. So this is a sort of summary of what we know about the impact of parental conflict on minority ethnic children. If we go to the next slide, we can look at the risk factors that are associated with parental conflict. As I mentioned, we don't have a lot of information about the prevalence of parental conflict among minority ethnic families. However, this can help us understand what kind of factors can increase the likelihood of parental conflict in these families. Starting from the left, the first box you can find is about economic stress and family and household stress. These can include different factors. We know, for instance, that financial stress can be impacted by external situations. We have evidence showing how COVID and the lockdown impacted financially on some families. And we can imagine that the same is happening at the moment with the financial situation we are living. But we can also consider unemployment, for instance, or poor housing conditions as other factors that can have an impact on parental conflict and the likelihood of parental conflict. Another important group is parents' risk factors. Those are factors that can happen to one parent. They don't have to happen to both parents at the same time, but they are very important. Mental health is one of the main risk factors we can consider, parenting practices, and substance and alcohol abuse. As you can see, we have arrows going with both directions. This is because we know that economic stress and family and household stress can impact parents' risk factors, but parents' risk factors can also in turn impact economic stress. Just to give an example, we know that mental health and having poor mental health can have a negative impact on employment. But at the same time, we know that experiencing unemployment can also have, or experiencing financial stress, can also have a very negative impact on mental health. The other green box we have in this representation is interparental risk factors. those are the risk factors that happen at the level of the couple. Co-parenting practices and interparental conflict are the two main factors that we should consider in this case. And again, we know that there are some dynamics between those factors. Taking again the example of mental health, we know that mental health can really negatively impact parental conflict, but parental conflict can have very negative consequences on mental health of parents. Those are the main risk factors that you should consider when you think about parental conflict and the impact on children. If you look at the other box we have on this representation, this is exactly one of the mechanisms, one of the most important mechanisms through which parental conflict can have an impact on children. And this is about how the child is exposed to parental conflict and how the child has to process the conflict. We know that this is not the only mechanism, but we know that we have to target this one to make a difference, to improve child outcomes. Just to give another example, we know that parental conflict, based on the evidence, can also have an impact on the parent-child relationships. And if you consider that, if you consider the parent-child relationship, sometimes there might be interventions just targeting that relationship, trying to improve outcomes for children. The evidence shows that if you're just targeting the parent-child relationship in a situation of parental conflict, you're not making a big difference because the child is still exposed to parental conflict and will still experience negative outcomes. If we can go to the next slide, please. As I mentioned, we have just limited data about the prevalence of parental conflict in minority ethnic parents, but we have statistics from the UK about the prevalence of risk factors. And statistics can help us to understand whether there are particular groups of families that might be at a higher risk of experiencing parental conflict. Starting from the left, we know that from statistics that between April 2008 and March 2020 in England, people in Pakistani and Bangladeshi households were consistently the most likely out of all ethnic groups to live in low-income households before and after housing costs. And this is about financial stress, so the first box we were considering in the previous slide. We also know from the evidence that women from minority ethnic groups are more likely than white women to experience a common mental health disorder like anxiety, depression, or obsessive compulsive disorder. These considerations shouldn't be taken, shouldn't lead to the idea that every time we have a risk factor, minority ethnic families are experiencing that risk factor or at a higher risk of experiencing that risk factor. And the next box is really an example of how in some situations minority ethnic families might have a lower prevalence of a particular risk factor. So if you consider Black and Asian ethnic groups, we know that they have a lower percentage of their parents just drinking at a harmful or dependent level compared to white British people. However, we also know that based on statistics from 2014, a higher prevalence of people from Black ethnic groups reported at least one sign of drug dependency compared to white British people. Now, this is just a summary of some of the statistics we have in the guide on supporting healthy relationships among minority ethnic parents. Something that should be considered, and it was also discussed by Miriam, is that it's clear from the evidence that we cannot consider minority ethnic group as just one group, one category. There are a lot of different characteristics based on cultural backgrounds and experiences for families. So when thinking about these factors, it's really important to think about what ethnic group you're considering and whether actually this is sufficient to understand what's going on in a particular family. If you can go to the next slide, please. So far, we have discussed the evidence showing how there are particular risk factors that might mean that parental conflict is a bit more prevalent among particular minority ethnic families. This means that we have to be very careful about thinking about how to support and how to engage minority ethnic families when we propose support in relation to parental conflict. If we go to the next slide, here we have a quick summary of engagement recommendations that we have produced as part of the guide. The recommendations that I'm going to discuss are based on research evidence, so international studies and UK studies, but also based on consultations we had with local leads and practitioners working with minority ethnic families to understand how it's possible to improve our strategy to support and engage families. When we think about engagement, there are different activities that we consider. We consider how parents are approached to access an intervention or service, the extent to which parents remain engaged with an intervention or service, the extent to which parents actively participate, to give an example, how they engage with the material proposed for an intervention and how they apply learning. And finally, how parents are involved in the governance, design, and quality assurance of services. To give another example, the lived experience of some families can inform local thinking and planning. So those are all the different aspects we consider for this particular section of the guide. If you can go to the next slide, please. Here we have a summary of some of the recommendations we identified looking at the research evidence and consulting with local leads and practitioners. In terms of the research evidence, we know that developing strong partnerships between multiple agencies can be very effective to reach families, and this is particularly true if you consider vulnerable families. And of course, some of the minority ethnic families you might need support might have some level of vulnerability. Also, staff should be provided with the desirable skills and sufficient time to engage with families, especially when families require a bit more time to build trust. If you think about then how to support local families and what we know from strategies used so far at the local level, we know that outreach, in addition to partnership working, is very important for reaching minority ethnic parents. We had several local leads and practitioners mentioning, for instance, the use of local champions to support engagement with minority ethnic families. Also, using trusted contacts can help to engage families. And finally, recruiting a diverse workforce is key. Miriam also mentioned that in the first part of the webinar. If you have someone speaking the same language or using culturally sensitive terminology, this can really help to have a higher level of engagement and to understand how you can get the support you need. If you can move to the next slide, please. We have a final slide here about the facilitators that can support engagement and can also help parents to stay in a particular intervention once they started intervention. So offering services flexibly, for example, remotely or online, has been discussed by local experts and has been identified from research evidence as an important strategy to ensure that parents can be part of an intervention and can keep using the intervention for a prolonged time. Services and interventions should also recognize families' reliance on extended families network and possibly engage with multiple family members when possible. And this is particularly important for parental conflict because we know that sometimes conflict might happen not just between parents, but also might include the extended family network. Staff may need to devote more time and attention to coordinate and reschedule missed sessions to sustain involvement. This is particularly true if you have difficulties in engaged families at the beginning. And then ensuring the content is appropriately tailored and culturally relevant to the target population was another key recommendation from local leads. Just to give a few examples, mixed group activities may not be appropriate due to cultural norms, or same-sex practitioners might better facilitate engagement for particular minority ethnic parents. So this is just a summary of some of the recommendations you will find in the guide, but we hope this is helpful just as a sort of snapshot of what we found so far. I think this is my last slide, so now we can open the floor to questions.
Thanks, Virginia. We've got a few comments and a few questions. Fataha came back with an additional comment, which I thought was worthwhile, about how important it is for families and parents who aren't particularly familiar with services here in the UK, who may not really understand what's on offer, but also in the context of giving consent, may not really understand what it is that they're giving consent to. So how important that makes the translation of key documents, basically. And we've had some discussions about this in the team, I know, and I think that things like assessments and TAF notes, even if you can speak a bit of English, actually reading something like that might be really, really challenging. So there's some real issues, aren't there, in establishing the right resources around interpretation and translation.
Yes, thank you, Di.
Sorry.
Can I just reply very quickly to that? It's a very important point. Something that we discussed also during the consultation is that sometimes it might not be enough to actually translate the information, and using also visual aids such as images can help. Plus, if you're using translators, it's very important to consider how particular terminologies may be translated, because for some cultures, actually, we might have different terminologies. And especially if you think about parental conflict, this is a sensitive topic. So you want to make sure that you have the right set of terminologies you want to use.
Okay, thanks. Leonora had a question around whether we had found any evidence that there was a link between parental conflict and children being returned to their home country by one parent, perhaps, and leaving a single parent, perhaps, back here, and accessing services would then be much more difficult. And also the impact on mental health. I don't know if you've got any comments about that, Virginia.
We haven't found specific evidence on this, but this wasn't really the focus of the guide. So it may be that actually there are some studies exploring, in particular, children being taken back to home countries. We haven't found particular evidence in the context of parental conflict, but it doesn't mean that we don't have studies on that.
Okay, that's great, thanks. There is a comment, I'm not sure I quite understand the one from Gemma, but in relation to the statement, working on the parental conflict doesn't make much of a difference because the child is still impacted by the conflict. I wondered what the reference research base is for this, please.
Yes, it wasn't working on parental conflict, but it was about supporting the parent-child relationship. Sometimes the focus is on the parent-child relationship, but we have evidence that if there is parental conflict in the family, working on the parent-child relationship is not sufficient to improve child outcomes. We have a bit more information on this in our outcomes framework. We have a link in the slide, but I can also share the link in the chat, so you can also read a bit more about that.
Okay, and something that's come in from Jakarin. I was wondering what experiences families have with children's social services. Do families understand statutory services and their own rights?
This is a very important question. We haven't explored this in detail, but when working with practitioners and local leads, we found it as an important challenge. If parents start discussions about parental conflict and children's social services are involved, there is always the worry that they will take the child away from the family, and this can be a very important barrier if you want actually to support a parental relationship. So we haven't really explored the evidence on the child services. I think actually Miriam might have some comments on this based on the research and the statistics she used for her project. In the case of parental conflict, we only know that this is a big challenge, and that, again, clarifying why you're offering support, what kind of support, and setting expectations is a very important part of the support you have to provide to families.
Okay, have we got time for another question?
Yeah, Di, we should be fine. We're doing well for time.
Okay, so Eric is asking, to what extent is co-production of intervention tools? To what extent does that support better engagement by minority ethnic parents and outcomes for children?
We don't have a lot of evidence about co-production so far, but this is a very interesting question because we know that actually something that a lot of local areas are considering and is always proposed as one of the solutions to improve engagement. So we have to wait to understand the impact of co-production, but we will definitely recommend to test it. We know also from discussions with different practitioners that this has been suggested by some minority ethnic families as an effective way to make sure that actually support can meet the local needs of families.
Okay, thanks, Virginia. Fataha is asking about whether there's any research into the impact of the conflict that's caused by separation due to migration journeys. Really interesting question, I think. I don't know if there's any research around that, but it would make a really interesting research project, I think. Do you know of any research in that, Virginia?
Not really, not from our perspective. So we haven't really explored this question in detail. I think it's very helpful. Something that we have explored is parental conflict in the context of separation, which is a bit different, but some of the considerations might be relevant here. So we have two different guides. One is to support healthy relationships among minority ethnic parents, and the other one is to support healthy relationships among separated and separating parents. And some discussions were about expectations of both parents. So there might be something interesting there.
Okay, thanks. Right, can we do one last one? Dan is asking, do you have any good examples engaging hard to reach minority ethnic groups and what this looks like? Which is a really helpful question as well. Thank you, Dan.
Thank you. This is a very important question. So we have some recommendations and some quotes in the guide on how some local areas are tackling this issue. And we have some examples of, for instance, local areas testing different approaches. So for instance, thinking about how to engage minority ethnic fathers, just looking for different places where fathers can meet and try to meet them in an informal way before supporting and offering support. We also have some considerations about using different terminologies. So for instance, rather than presenting relationship support as support, proposing some webinars or meetings to discuss information about the impact of parental relationships. And this has led to a better engagement in some cases, for instance, from fathers. So I think there are different approaches. Sometimes it's more about the language, sometimes it's about really how to plan outreach activities. There is something in the guide, and we really hope we will be able to share more examples in the future.
Do you want to say anything else specific, Virginia, about specialist RPC interventions?
Yes, thank you, Dai. Just something that it's not in the slide, but it is in the guide. You might wonder what kind of interventions you can use to support minority ethnic families in the case of parental conflict. In the guide, we have a table presenting different evidence-based interventions with evidence of improving outcomes for children and parents from minority ethnic backgrounds. We have some UK interventions such as empowering parents, empowering communities, but we also have international interventions such as family checkup for children or promoting strong African-American families. You can find more information there, and you will also find information about the evidence of impact and the different factors and outcomes that have been improved thanks to the intervention.
Great, thanks, Virginia.
Thank you, Virginia, and thank you, Di, for taking us through the Q&A as well. So I'm just going to bring us to a close now, just to say a huge thank you for attending today and also contributing to the session so thoughtfully with your reflections and questions. Very quickly, just before we do close, we've only been able to, I suppose, to touch on a very small section of the findings of two much bigger pieces of work today. So we will share those resources in full, and we would really encourage you to consider those in the context of your local area in your work, and we will send those links out with the recording of the webinar, where you'll also be able to access the slides. And we're also continuing our work in this area, so we would really value your involvement as part of that, and that includes a series of focus groups to further our understanding in regard to support for minority ethnic families, and then the development of more sort of guidance in terms of supporting practice in this area. So hopefully that starts to build on some of what we've discussed today, and we would really value your involvement in that. And then also sort of the development of a language guide, including some support for practitioners supporting minority ethnic parents, some of which Virginia has introduced and discussed today. So just to close and just say again, thank you very much for joining us. We hope you found the session useful, and thank you for your questions and contributions, and we hope to see you at a future similar event soon. So thank you very much.